Hi, I'm Lisa Hayden with Channel 6 Central Kentucky TV, community focus on Washington County. And I'm happy today to have with me a Washington County young lady, Melinda Matherly. Welcome, Melinda.
Thank you. Thank you for having me.
Of course, before you were a Matherly, you married a Andy Matherly from Washington County, but prior to that, you were a Noel.
Yes. I'm originally from Mackville. Very proud of that. Small town girl, and it helps when you're practicing medicine locally that you have local roots, and so you understand people, you understand farmers, and you know, as much as we in dermatology and in skincare, we're stay out of the sun, stay out of the sun. We understand many of our patients in this area are farmers and construction workers, and you know, their livelihood depends on being out in the sun. So you meet them where they're at.
Yeah.
You have to, you know, they don't work in office buildings and in behind a desk. They are out there, you know, providing the food and building the home.
Well, and they're out in the sun all the time. And
Right.
since it's skin cancer awareness month,
Yes, it is.
who did I think of right away? But you.
Thank you.
And Melinda, because of course I go to the dermatologist twice a year for a checkup,
Right.
thanks to your recommendation. And you know, when you're fair skinned, you do have, and especially as you get older, because when you're young, which of course I didn't know this, and now I think young people know this, because the dermatologists have pointed this out, but when you're young and your exposure to the sun is what causes you the problems later in life.
Right. We get about 25% of our sun exposure by the time we're 18 years old. So it's important for our children to apply sunscreen, but it's just as important for folks in their 20s and 30s and 40s and older to continue to apply sunscreen. Even though we didn't when we were young, it's not too late. People say, oh, it's too late, I've done all the damage. That's not true. We continue to get sun exposure and to get damage as the years go, so we need to continue to be good about putting our sunscreen on.
Okay. And so now, Melinda, then when you mean sunscreen, what do you mean by that? I know they're always talking about certain, you know, you need at least a 30, or tell me about that.
So one way you can protect yourself from the sun is with hats. You know, they have hats that have the UPF, the open back hats. Sun visors don't really count. I mean, that does help protect your face, but not your scalp. So a wide brim hat is a good idea. They do make sun protective clothing. And it used to be very expensive for sun protective clothing, but Walmart actually has a Hanes brand. It's like $8 a shirt. They've got a short sleeve and long sleeve, and you'd be surprised at how cooling those shirts actually are. Because they protect you from the sun.
And are those for adults and kids?
Yeah.
Because I see these kids now go to the pool or outdoors, and they have all these long sleeve clothes on and long pants, and I'm thinking, what is this?
Right.
And then I realize, of course, it's to protect you from the sun.
Absolutely, and that helps with parents trying to chase little kids down and trying to get sunscreen on them. You know, it's kind of like wrangling cats sometimes. It's hard to do. So if you have a sun protective shirt on them, it makes your life a little bit easier. But for adults as well. We just got back from a trip to Key West, and my whole family, we have UPF shirts, and we sometimes look silly. We feel like we look silly out there with our long sleeve shirts on, but it really is good. A good practice. The other ways to protect your skin, of course, are when you shade. You know, get under an umbrella. Make sure it's a sun protective umbrella. If you buy one for the beach, make sure it's got that silver lining on the inside. Some of those surf shops sell like a $9 pop-up umbrella, but they are mesh and they aren't really sun protective at all. The other ways you can protect, of course, are with sunscreen. And this is a 30 SPF and a 50 SPF. You want to use at least a 30 SPF. 30 SPF blocks out about 97% of UVB rays. UVB rays are the rays of light that are responsible for high skin cancer risk. UVA light is responsible for photoaging, so what makes you look old and wrinkly, and which that sometimes is more of a deterrent than skin cancer for people. You know, that's true.
I wish I'd known both those things at an early age.
But this SPF factor is based on the UVB blockage. And then 50 SPF blocks about 98% of rays, so that's why you hear the literature or all the advertising, you want to at least use a 30 SPF. 15 SPF only blocks 93%. And that sounds good, but that 4% is a huge difference. So you do want to for sure use a 30 SPF. The key is to reapply. One time is not enough. You need to reapply. They say they're water resistant for 80 minutes. They're not waterproof. So if you get out, you towel off, you probably should reapply. You want to use, if you're using a lotion, you want to use, and speaking of my Key West trip, I got a shot glass there. You want to use a 1 ounce of sunscreen for your entire body. So you should use the equivalent to what would fit in this shot glass for your whole body. So if you're on the beach all day, you're going to use 1/4 to 1/2 of a bottle. So, you know, one bottle of sunscreen won't get you all the way through. And that's the thing. The higher SPFs help you. Studies show that people use about 1/4 of the amount of sunscreen that they're supposed to put on because it's expensive. I mean, you know, this bottle's $8. So if you use a higher sun protective factor, it helps sort of bridge the gaps of human error and not applying it, you know, as thickly as you really should. The sprays, there's been a lot of debate about the sprays. Sprays for little kids aren't necessarily good because they inhale the spray. Mm-hmm. But if you've got an older child, and most certainly for adults, sprays actually work quite well too. They're very convenient. That's what makes sprays really nice. I tell farmers, you know, throw it in your tackle box, your toolbox of your tractor, and just spray it on. Golfers, throw it in your golf bag. You can spray it real quick.
Yeah.
And I say your buddies might make fun of you, but when they're sunburned and you're not, then you can make fun of them.
Yeah. Well, and you know, Melinda, I hate to say it, but men, I mean, I'm not trying to be sexist, but they're not very good oftentimes about applying sunscreen. I don't know if they think it's a sissy thing to do or what, but I mean, you know I used to fuss at my husband all the time about it because he wasn't very good about keeping it on. And
I'm
it's
hopeful
important
for future generations, though. Like my children have been raised that they don't know the difference. Like they don't even really know what a sunburn is. I mean, I remember by the time I was 15, I'd had numerous sunburns because we just didn't have sunblock. So my kids don't even realize what a sunburn is because they've been sunblocked. So I'm hoping that it's hopeful that for future generations there won't be such a steadily increase in skin cancers like we've seen.
So Melinda, now with this increase in melanoma, what should people look for on themselves? And you know, shouldn't they go see a dermatologist if they suspect something?
Absolutely. Everyone should have a full skin check once a year, and that's take all your clothes off. Have somebody look at you everywhere, between your toes, your fingernails, your toenails, on your bottom. Melanoma, we typically say follow the A, B, C, D, E's of melanoma, and I've got some pictures. This is an example of asymmetry. And asymmetry means that the lesion, if you were to divide it in half in any way, it's not equal. So you see 1/2 of this lesion, if you were to cut it in half, 1/2 looks completely different than the other half. And in a normal mole, you pretty much could divide it in any way in half, and it looks pretty much the same, like a mirror image on each side. You want to look for the border of your mole. This mole is a perfect example of an irregular border. The border's very jagged, very bumpy, it's not round, it's not even. So you want to look for the border of your mole. That's the B. The C is for color. Melanomas come in all colors. They are sometimes black, they're sometimes brown, they're red, they're white, even a bluish color. If you see a mole that has numerous colors in it, that is a problem, so watch for the color. The D is for diameter. Diameter is how big around the mole is. This mole is on a cheek. You can see the corner of the mouth and the fold of the mouth there. That mole is probably about this, you know, it's probably a good sized mole. The diameter greater than a pencil eraser, anything greater than that. Now, that doesn't mean every mole that's bigger than a pencil eraser needs to come off. It's just that sort of a good general guideline. And then the E, which is kind of a new one in the last several years, is called evolving or evolution, and that's if the mole is changing. So if you know that you've had that mole your whole life and it was little and you watch it over the course of a year or several months, you notice that it's changing and growing, then any change in the mole, then you need to let us know about that and we can just do a simple biopsy and remove it. So those are the A, B, C, D, E's of melanoma.
Yeah. So, and you shouldn't I mean, you should go right away. You should make an appointment and go as soon as possible.
Right. The smaller that a melanoma is, or any cancer, basal cell or squamous cell skin cancer, the smaller the cancer, the easier it is to get rid of. And even melanomas that are advanced, there are more than 30 medicines now to treat advanced melanoma. So there are folks that have had family members that have had melanoma and they sort of feel defeated if they get diagnosed well. But care for melanomas has improved so much in the last few years. There's lots of things that we can do, so it's never too late to get it checked out.
So, Melinda, can you just go to your family doctor, and then if they observe a problem, go on to the dermatologist? Or, I know in my case, I guess I prefer, because I know you deal with it every day. Dermatologists see it every day.
Right.
And, I guess I'm not trying to, but everybody specializes, and so you would want really someone who's trained at looking at those all the time.
Right. Your primary care is an okay place to start, but I did internal medicine for 11 years before I was in dermatology, and I will tell you that in general medicine, we are so busy taking care of people's blood pressure and their diabetes and their joint pain and their emotional issues. I mean, that the skin really sort of takes a back seat to all their other problems. And when you come to the dermatologist, your skin, your largest organ on your body, is primary. That's what we're looking for. That's what we look at every single day. So I do advise that. Of course, that's my field, but I do know with my previous experience in general medicine, it often is the last thing that you're worried about. I mean, you're so busy doing other things for the patient that unless they directly point something out to you, and then a lot of times you're so busy doing other things that and you've learned so much, and so much of your knowledge is based on other disease states and other organ systems, that really a specialist in skin is where you need to be.
Yeah. So, and we have, we are lucky that we have the dermatologist, Dr. Sally Sloan, that comes to Washington County, and then I don't know if there are any other dermatologists that come to Washington County.
No, there's not anybody else that comes to Springfield, but Associates in Dermatology comes to Lebanon, and then there's Dr. Kelly Morgan in Bardstown. There's enough patients for all of us. So, because everybody needs to be getting their skin checked. So, as long as you're seeing somebody, that's a good idea.
Yeah, and so now, of course, I have to ask you about this, because you know how these young girls are. They're going to the prom. They're going. Out to all these events, and they want a tan. So, Melinda, all these sunscreens, they're great. Of course, if you don't care anymore about getting a tan. But what about if you want a tan? I mean, everybody, I have a feeling that the tanning bed is off limits.
Absolutely. It's a huge no-no. The concentrations of UV rays you get there, the sun doesn't even rival it. That's the whole thing about skin cancers increasing. We were so much smarter in the 20s. It used to be a socioeconomic status. If you were pale, that meant you were well off. The paler you were, the prettier you were, because you didn't have to go outside and work. You got to stay inside the house all day. Well, that changed in the 20s and 30s as our society became more, industrialized. So, and even our clothing, women used to wear bonnets and gloves and carry parasols and long sleeve shirts and long skirts. And men, long sleeve shirts, long pants all the time in the summer, 100 degrees, they still wore that. Well, our society's become so smart now that we barely wear any clothing. You go out to mow the lawn and it's the halter bikini top and the short shorts. You get as less clothes on as you can get. And that is so wrong for our skin. And that is one of the main reasons why skin cancer rates have increased, is we don't wear as much clothing, protective clothing, as we used to.
Yeah.
But yes, tanning beds are for sure a no-no. Sun exposure before the age of 18 increases your risk of skin cancers by 5 times.
Oh,
even
my
one
gosh.
time in a tanning bed. So I'm a don't go picket in front of in front of those places, but I do encourage the young women that I see to please stay out. But if you go to the tanning bed, still come see dermatology. We don't chastise people. We don't scold you or treat you poorly. Like, you need to see us as much, if not more, than anybody else. So we still encourage women and men alike that is one of the things they do. We don't want to turn them away or turn them against us or keep them out of our offices. We want them to come see us so that we can keep an eye on their skin and look for things as they pop up.
Yeah. And of course now, Melinda, they're making, I don't know how all those, but gosh, if I go to the tanning bed, I get those spray tan things.
Yes. They're wonderful.
I don't think they hurt you, as far as I know.
No, they are completely safe. We encourage those. In fact, we thought about in our office getting the airbrush kind and doing it as a service for people to keep them. But there's plenty of salons that are doing that now.
Yeah, I mean.
But that's a great idea.
Yeah. Now
the sunless tanners. You still need to use sunscreen if you use sunless tanner, though. So if you get spray tan, that doesn't protect you at all. So you want to get your spray tan, but then when you're outside, then you still want to use your sunscreen.
Okay. And so then all those spray tans that you get, at the store, those cans of things and all that kind of stuff, or rub on, all of those things are okay, right?
They're totally safe to use and encouraged, because if that keeps you from laying out in the sun or keeps you from going to the tanning bed, we are all about it.
Okay, that's good to know. Now, let me ask you this, because I know that, of course, I used to like to lay out in the sun. Matter of fact, I still do. So anyway, but I always use my sunscreen. Right. However, because you get a little of that vitamin D and C or whatever, and it's kind of feels therapeutic sometimes. Mm-hmm. But if you're like in your, I know these people that are on the farm or even driving in your car. I understand that you should be wearing your sunscreen just like every day.
Right, like a lotion. It's a good idea to use your sunscreen as a lotion. And there are some daily lotions that have SPF 15. That's better than nothing. But if you just put on your 30 SPF as your lotion when you get out of the shower, it's a great idea. I drive about 35 to 40 minutes to get to work myself, and I have little sample bottles, and I'll hit the arm.
Yeah.
Because
your
arm and face get a ton of sun. Most of our facial skin cancers and pre-cancers are on the left side of the face because of driving in the car. We get so much sun in the car that we don't realize we're getting.
Yeah. That's amazing, because you don't even think about that.
Mm-hmm. If you look at most people, they look older and more damaged. If they've driven at all, they look older and more damaged on their left side.
Uh-oh. I better get my left side. I might have to cover my left side up then. And that's the side I sit on here, so I'm going to have to trade sides, Melinda. We need to trade seats. So, and is there any other thing that you think we should have our listeners be aware of?
Just a few of the myths. Sunscreen does not cause skin cancer. It does not. There are no scientific studies that show that. We have seen an increase in skin cancers throughout the years, and people go, well, gosh, we've been using sunscreen that long. We have an aging population that have had enough sun exposure to get cancers. We live longer, which is why we're seeing more skin cancers. Tanning beds are another factor, in our clothing choices and our lifestyle. Being outside more and seeking the sun and more recreation and boating and that kind of thing. So those are the reasons. Another myth, that people of color do not get skin cancer. People of color do get skin cancer now, much less frequently than white people, but Hispanics and African Americans are also at risk for skin cancer. They're often underdiagnosed because the cancers don't look the same or they're not as usual. But that is a myth sometimes that's out there. I've got skin of color. I won't get skin cancer. That's a myth. Those are just a few of the things I thought of to kind of dispel.
Yeah, and of course, you know, thinking about little ones that you get out, babies and little toddlers and things, I think they make really heavy sunscreens, and they do need to have that on, don't they? By all
babies
means.
older than 6 months of age need to be sunscreened. Children under 6 months, it's not advised to put sunscreens on them because of the chemicals. So under 6 months, keep them in the shade, keep them in the house. Hats, sun protective shirts if they're under 6 months of age. Over 6 months of age, sunscreen is great.
Okay, okay. So that's good. That's good information. Well, Melinda, you're just a wealth of knowledge.
Thank you.
And I appreciate it so much because I know you've helped me. So, so everyone listening out there, be sure and follow Melinda's recommendations here. It is Skin Cancer Awareness Month, and we do, you know, we want to prevent melanomas and skin cancer. So please heed this advice.
Thank you.
Tell them, Melinda.
That's right. Listen to us.
All right. Thank you.
Thank you.